Today I will be talking about the homeostasis again, and this will be our part 2 part 2 of homeostasis. And I have been already uploaded the part 1 where I briefly talked about the general concepts of the homeostasis and gave the example of negative feedback mechanisms. Now in this part 2, I will be talking about the positive feedback mechanism, and then some control systems, some control system of the body. One example of the control system of the body, how body's control system, if any changing there is occurring, tries to maintain the homeostasis and return the physiological value towards normal. So let's begin with positive feedback mechanism examples. Positive feedback mechanism, and I will also at the end I will talk about the feed forward mechanism, which is a bit complex. I will try to clear the concept in that also. Positive feedback mechanism, as mentioned earlier, most of the control system of body, and most often body uses the negative feedback mechanism to maintain the homeostasis, but sometimes positive feedback mechanism is also efficacious and useful. Let's see how. I will taking here example. There are many examples. I will taking here example of childbirth. In positive feedback mechanism, childbirth, which is very important work and very important mechanism that occurs by a positive feedback mechanism. And this childbirth, this feedback mechanism you can write in the homeostasis also. Since your question will be asked like define and describe homeostasis with positive and negative feedback mechanisms. So in positive feedback mechanism you can write this childbirth as an example, and this childbirth in KU BDS 2024 in reproductive block, this question was asked that describe the childbirth. So in reproductive block it will be also important. Childbirth, here I will draw a rough figure. This is very rough figure of the female reproductive system. Please consider the I am not good in drawing the figures. Let's suppose here is the cute baby. This will be your placenta. The figure is not good. Remember, this is a cute baby, and term is reached for the delivery. Then what occurs as at the end of the pregnancy term, during delivery, this uterine muscle, uterine smooth muscle gets contracted, and this cervix should be relaxed so that childbirth can occur, and the main hormone of this uh, parturition is the oxytocin. You know well. I will be talking about detail in oxytocin in the endocrine block. Just here remember, this oxytocin has important role in this childbirth. What happens when uterine contraction becomes strong enough to push baby's head baby's head through the through the cervix, through the this baby's head. When uterine contraction becomes strong enough to push the baby's head through the cervix, through the cervix will dilate. Cervix will dilate. Cervix will dilate, and this dilatation, once cervix starts to dilating, it sends signal to the body of the smooth muscle of the uterus, and this signal cervix send cervix sends signal to the body of uterus in a smooth muscle, a smooth muscle, once cervix will dilate, it will send back signal again to the body of the uterus. Then body of the uterus contracts stronger enough again. This feedback leads to even stronger contraction of uterine smooth muscle, and this contraction again lead to the further dilatation of the further dilatation of cervix, cervix. This mutual effect to each other, body of the uterus and cervix, as cervical dilatation send the signal to the uterus, and uterus gets contracted even more strongly, and that contraction lead to the cervical dilatation even better or more. And this mutual effect, when gets stronger enough, this when this mutual effect gets strong enough, strong enough, child will born. Baby or child will born. Baby or child will born. And this, if the contraction is not strong enough, if the contraction and dilatation is not the enough, the stimulus will die, and next stimulus again establish only after few days, only after few days. And I took this reference again from textbook of medical physiology by Guyton and Hall, restricted South Asia, publication 14th edition. You can take the reference and you can read there also. So this is one of the positive feedback mechanism and is important for the parturition of the baby, childbirth. And this you can write this example in feedback mechanism, positive feedback mechanism also. And if reproductive block, if there is asked to write about childbirth, you can write this there also. And there are many other positive feedback mechanism examples. In MCQs, you will also be asked that all of the following are the examples of positive feedback mechanism except like childbirth, ovulation by surge of LH, luteinizing hormone, generation of the action potential, blood clotting. These all are the examples of the positive feedback mechanism. Like many hormones, as I mentioned in part 1 video, that many hormones uses the negative feedback mechanism, but one important hormone, luteinizing hormone, during the ovulation by positive feedback mechanism, LH surge occur and the ovulation occur. In the same way, generation of action potential, what will occur? Stimulus, if the stimulus causes influx of the sodium ions to the nerve fiber, this influx will raise the potential inside the membrane, raise towards positive, and this raising again leads to further opening of the sodium channels, and further more sodium ions will get influxed, and this when reach to the threshold potential, firing of the potassium influx occur by opening of the voltage gated sodium channel, and action potential will generate and travel till the ending of the nerve fiber. I will talk in detail about the action potential, how this occur. And blood clotting, when blood vessels get ruptured, activation of clotting factor or clotting cascades activation occur, and this activation of clotting factors, once some clotting factors get activated, these factors activate more clotting factors, and this action remain continued till the ruptured blood vessel get plugged with the clot and bleeding stops. Again this mechanism, this clotting factor mechanism gets some vicious cycle. For example, in case of the angina or myocardial infarction, what occur in if there is plaque accumulation of the accumulation inside the endothelium, plaque accumulation in the coronary arteries. When by any means if this plaque gets ruptured, it ruptures the endothelium, and this endothelium ruptures again activate the this clotting mechanism, and by clotting mechanism this will lead to the again plugging of the these coronary arteries and block the blood vessel, and if the particular blood vessel branches of the coronary arteries supplying particular area of the heart will get affected by ischemia, that leads to the myocardial infarction. So this positive feedback mechanism sometimes gets vicious, and that can ensue or lead to the death also. I will see that also. The moral of the story is that positive feedback mechanism is not always useful, but sometimes it gets vicious and death can occur. I will giving the examples. And one more conclusion from this positive feedback mechanism, you can draw is that if the if the initiating if the initiating if the initiating if the initiating stimulus causes more of the same it is called positive feedback. It is called positive feedback mechanism. Positive feedback mechanism. You can see here, once uterine contraction once uterine contraction begins, that contraction lead to the further and further more contraction and dilatation of the cervix, that the stimulus causing more of the same, that is more contraction and relaxation of dilatation of the cervix, that ultimately lead to the childbirth. Same you can see here this sodium influx, once stimulated this membrane, the sodium, if the stimulus is strong enough, the sodium influx occur, and this sodium influx raise the resting membrane potential inside the membrane, inside the nerve fiber membrane towards positive, and that raising of the potential inside lead to the further opening of the sodium channel and further influx of the sodium ions occur, and this process occurs in the manner that threshold reached, if the stimulus is strong enough, threshold is reached and firing starts, and by opening of the voltage gated sodium channel, action potential generate and travel all the way to the end of the fiber. Here also in clotting mechanism, when once the stimulus causes the activation of the one or more clotting cascades, that lead to the further activation of the remaining required cascades, and this will increase in the manner that ultimately lead to the plug formation by clotting and block the blood vessels, and if there is bleeding occurring, that bleeding will be inhibited. So, our definition matches this with this example, that if the initiating stimulus causes more of the same, it is called positive feedback mechanism. Now, I will be showing that this positive feedback mechanism is not always useful. Not always useful. Let us take here an example again from textbook of the Guyton and Hall medical physiology. Let us suppose this axis, y axis, showing the blood pumped by heart, and this x axis showing the time, let's see, this is 0 1 2 3 1 2 3, time in hours, and blood in liter, blood pumped in liter. Let's suppose 1 2 3 4 5 liter, 5 liter. Three, 4, 5. Our topic will be sometimes, and you can be asked to write short note on this, that sometimes positive feedback mechanism can lead to the vicious cycle. How? This will be your short note question. Let's suppose, as we know, if there is any change in the physiological value changes, body's feedback mechanism will try to return that value towards normal. Let us suppose here loss of 2 liter blood occurs, loss of 2 liter blood occurs, and here loss of 1 liter blood occurring, 1 liter loss, here 2 liter loss. If the blood by any means trauma or any other mechanism, if there is 1 liter loss of blood among 5 liter of normal value, then body by positive feedback mechanism, if 1 liter blood loss occurs by positive feedback mechanism, body will compensate the loss within few hours. As given in the book, the average time taken is about 3 hours. About 3 hours. And positive feedback mechanism, the sympathetic nervous system will get activated, and by other mechanism blood vessels get contracted, heart rate increases, and the normal supply of the oxygen and nutrient to the tissue will be maintained, and their negative feedback mechanism will be also helping to raise the blood volume and blood pressure, as in case of the renin angiotensin aldosterone mechanism mentioned earlier. But if there is 2 liter loss of the blood, if there is 2 liter loss of the blood, the body's mechanism, again positive feedback mechanism will establish, and if there is 2 liter loss of blood, by positive feedback mechanism positive feedback mechanism will increases the heart rate, and if the heart rate gets increased to compensate the loss, and uh, carry the nutrient and oxygen to the tissues in required amount, the blood supply of the heart, blood supply of heart gets compromised. How? Since blood, since heart is pumping the blood, so fast and rapidly, and heart contraction is strong enough, the coronary supply get decreased, and if the blood supply get decreased blood supply will lead to the weakening of the heart, Why? How? Because when the blood supply gets compromised, relative ischemia occur, and the heart will not get required amount of oxygen and nutrient, and this will lead to the weakening of the heart muscle, and body again here demand is increasing in heart also. Since heart's activity has increased, demand of the heart will also increase, but heart will try to compensate the nutrient and oxygen more towards the other tissues, other organs, and self nutrient and oxygen supply gets compromised, and this will again lead to the weakening of the heart. As the time will pass, the heart will gradually gets more and more weakened. Time time will come, the heart will get strong enough weak that the ischemia will lead to the necrosis of the heart muscle, and heart will get necrosed, heart muscle will get necrosed, and the ultimately the heart will stop the functioning and death can ensue. This is the vicious cycle. If there is excess loss, 2 liter or more blood loss, that lead to the vicious cycle. Again, the moral of the story is that the body's control system can only reverse the change and compensate the loss if there is certain and less amount of the change there is occurring. But beyond the limit, beyond the control system, beyond the capacity of the control system mechanism, if the loss is occurring, the control system will get failed, and the feedback mechanism can no longer return the value towards normal, and this can occur. So this feedback mechanism has limited capacity to return the value towards normal if there is severe change occurred. But since there is time, few hours, the death is causing ensuing after few hours. If the loss is again more, 2 milliliter or more, for example here, if we can transfuse the blood adequately in time, within 1 or 2 hours, that can aid on the feedback mechanism, and we can save the patient. If the timely we can transfuse the blood, and the transfusion is if successful. So this is the limitation of the body's feedback mechanism. Now I will talk about gain of the control system. Let us take an hypothetical example. In certain person whose baroreceptors are not functioning. Baroreceptors are not functioning. What are baroreceptors? This baroreceptors is actually, let's suppose this is the arch of aorta. Here will be left common carotid artery, and this will be your, this is your right common carotid artery, right common carotid artery, common left common carotid artery. This is your right common carotid artery. This is arch of aorta. For short term regulation of the blood, baroreceptors play important and effective role to maintain the blood pressure towards normal. In case if the blood pressure or blood volume is increased or that decreased. Mainly I will see we will be seeing here the in case of increased blood volume and pressure. So somewhere here these are percussion, somewhere here reside the baroreceptor. Baroreceptor we call it as carotid sinus, and somewhere here will be your aortic sinus. Sinus is something dilated part. Here some dilated part act as the baroreceptor, and in that region their carotid body and carotid aortic body are also present. That bodies are the chemoreceptor, but the sinus are the baroreceptor. This baroreceptor is, if let us suppose, non-functioning, and we infuse certain amount of blood and also assume the person's blood pressure is 100 millimeter of mercury. Then after transfusing certain amount of the blood, if the baroreceptor is not functioning, then blood pressure of that person is raised to 175 millimeter of mercury. 175 millimeter of mercury. So since baroreceptor is not functioning, as the blood is infused, volume will get increased, and that volume exert the extra pressure, and blood pressure will increase. And again let's suppose in same person and same amount of blood, same person, same amount of blood is transfused or infused, whose baroreceptors are functioning. This is these baroreceptors are again part of the control system, are functioning. Same amount of blood transfusion will lead to the only raised blood pressure, will lead to blood pressure this time raised to 125 millimeter of mercury only. 125 millimeter of mercury only. Then how much this baroreceptor, how much correction does, how much correction does, each correct the baroreceptor correct the minus 50 millimeter of mercury. Minus why? Because this is this baroreceptor decreases the blood pressure by minus 50 millimeter of mercury when the baroreceptor is functioning, but still the initial blood pressure is 100 millimeter of mercury, still 25 extra 25, still error is remained, how much error is remained, plus 25 millimeter of mercury still remain to be corrected. Corrected how much? Minus 50 millimeter mercury, error remain plus 25 millimeter of mercury. The moral of the story, again we can draw the conclusion, we can again draw the this feedback mechanism is not effective 100% effective, is not 100% effective, but lead to the as much as corrected value towards the normal, but not 100% effective. If it would be 100% effective, the baroreceptor would return the blood pressure at 100 millimeter of mercury, but it remained certain amount of correction to be remained as error, for example here plus 25 millimeter of mercury. So from here let us calculate gain of the control system, gain of control system, gain of control system, gain of control system, it will be calculated as correction upon error, correction upon error. So how much correction is done? Minus 50 millimeter of mercury and error remained plus 25 millimeter of mercury, this will lead to the minus 2, minus 2. This implies the feedback mechanism is not 100% effective to correct the change in the physiological range, physiological value. So this we can calculate the gain of the control system. At the end after giving one positive and negative example, feedback mechanism example, you can also add, if you have time, this gain of the control system that will describe that the body's control system is not 100% effective, Now I will talk about the very complex feedback mechanism, that we call as feed forward mechanism. Feed forward mechanism. Feed forward mechanism. Feed forward mechanism. What is this? Sometimes the body should or must react so rapidly against the stimulus that it has not enough time, to reach the sensory stimulus to the brain and again return to the periphery to control the action or movement. What is that? Sometimes body should react so rapidly that there is no there is no enough time to reach the sensory information from periphery periphery to periphery to brain and again back to periphery to control the action or movement caused by some stimulus caused by some stimulus. Control the action or movement caused by some stimulus. In that case, body uses the feed forward mechanism. In feed forward mechanism, I will take here example of, let's suppose take example of reflex action. Reflex action is mainly controlled by the spinal cord.